Hello there, your nurse on duty is back. In this video, I'm going to discuss the causes of anemia. There are 42% of children and 40% of pregnant women affected with this kind of disorder. I include three main causes of anemia. First is impaired productions of the RBC, that is the disturbance of proliferations of stem cells and erythroblasts, where the bone marrow is affected with malignant tumor, fibrosis, or granulomas, and any pathologic disorders that may cause the alterations on the productions of the red blood cells. And also, increased destructions of the red blood cells or hemolytic disorder. It is divided into intrinsic abnormalities and extrinsic abnormalities. In intrinsic abnormalities, it is more on hemolytic anemia caused by genetic disorder and infections and autoimmune disorder. Under the extrinsic abnormalities, it is more on antibodies mediated that causing for the destructions of the red blood cells. I include some pathologic disorders that is related to each topic. So please don't skip, finish my video. Don't forget to like, subscribe, make some comments on what topic you want me to discuss. Click the notification bell so that you will notify on my next video. Okay, let's discuss the disturbance ng proliferations and maturations of erythroblast. So let's review first yung normal physiology ng red blood cells. Ang red blood cells or erythrocytes, nagtatravel siya through the circulatory system, carrying oxygen to the body tissues and organs while remove yung waste. Isa siya sa pinakamataas na volume ng klase ng blood into the circulatory system. So yung RBC magta-travel sa lungs and through the process of diffusion, mag-a-attach yung oxygen molecules from the lung attached to the hemoglobin. Ito yung protein in the blood cells or RBC that contains iron. So yung oxygen, marirelease or dadalhin niya sa tissues and organs. Then in exchange, yung hemoglobins, magbabind naman siya together with the carbon dioxide and other waste. These waste products, nagtatransport siya away and remove as blood continues to circulate. So yung red blood cells are constantly being produced in the bone marrow at nagre-replenish siya, especially in response to hypoxia. Average lifespan niya is 120 days. So kung mayroong hypoxia, magpuproduce ang bone marrow. Dito sa topic na to, we're talking about disturbance and proliferations of keyword erythroblast. Pero ang RBC, ang tawag natin is erythrocytes. What is the difference between the two? So, kailan nagkakaroon ng erythroblast? Yung erythroblast kasi, in response to hypoxia, the bone marrow produce more RBC. But since there are increase in demand because of the presence of hypoxia, lalo pag bumababa na yung oxygen level ng patient, ang kidney i-release ang erythropoietin para mag-produce ng maraming red blood cells. Sa bone marrow, mag-i-increase ng productions ng RBC. Since nag-respond siya sa siya, bago siya maging mature, nare-release na siya sa peripheral blood. So sa test, lumalabas na maraming nucleated red blood cells or erythroblast in the peripheral blood. So since erythroblast siya, premature pa siya or dahil siya kulang sa cofactors or kulang pa siya sa panahon para ma-develop. So anong kaibahan ng erythroblast sa erythrocytes? Ang erythrocytes, there is an absence of nucleus. Bakit wala siyang nucleus? It allows the red blood cells to contain more hemoglobin. So therefore, nagkikarry siya ng mas maraming oxygen molecules. It allows the cells to have its distinctive biconcave shape which aids in diffusions between carbon dioxide and oxygen and some of the waste product. So let's talk about the disturbance, about the maturations ng red blood cells. We have three cofactors: folic acid, vitamin B12, and iron. Let's start with folate acid. This is the vitamin necessary for essential for the formations and maturations ng RBC and for DNA synthesis. So, ini-stored siya in the form of folate and as coenzymes in metabolic processes. Water-soluble in heat level siya. So, mostly, the folic intake is excreted and unabsorbed. Vitamin B12 deficiency is pernicious anemia. Progressive yung megaloblastic macrocytic anemia ang tawag dito. Both folic acid deficiency and vitamin B12 deficiency nagkukos siya ng megaloblastic anemia, or sa test lumalabas na very big from the normal structure or normal size ng RBC, malaki yung RBC. Possible cause nito is inadequate dietary intake, yung faulty absorptions from the GIT due to possible parasitic or bacteria, gastric surgery, and absence ng intrinsic factor, and hydrochloric acids in the stomach, pancreatic insufficiency. Iron deficiency anemia, so yung iron content is decreased below normal level and iron stored are depleted. Normal range is 65 to 165. So, it means if there's an anemia, it's below 65. Risk factor nito yung may history ng ulcers or gastritis, GI tumor, malabsorptions. So, mapapansin mo it's more on the absorptions of the cofactors, abnormalities, digestive system, premenopausal or menorrhea, and alcoholism. Disturbance of proliferations and differentiations of stem cells. Example is the aplastic anemia. It is a condition where the bone marrow does not produce sufficient T cells to replenish blood cells. So it means that the bone marrow is having hypoplasia and fat replaces the bone marrow. Also referred as pancytopenia. Patients could have anemia, leukemia, or thrombocytopenia since all the blood component is affected, which includes the RBC, leukocyte, and thrombocytes. Fanconi anemia is a hereditary disorder or defect featuring aplastic anemia and various other abnormalities. Risk factors or cause is autoimmune disorder. It could be congenital, acquired, or idiopathic, infection, radiations, and some medications. Anemia can be caused by kidney failure due to insufficient productions of the hormone erythropoietin, which is very important in the productions of the RBC. It is the one responsible for stimulating the bone marrow to produce red blood cells. And endocrine disease may alter the productions of erythropoietin, resulting for anemia. Other mechanism of impaired RBC productions is replacement of bone marrow by other materials such as malignant tumors, fibrosis, or granulomas. RBC productions is decreased if bone marrow is suppressed. Another sample is thalassemia. This is a group of hereditary disorder associated with defective hemoglobin chain that is necessary sa hemoglobin production. So, hindi lang siya isang hereditary disorder but a group of hereditary disorder. Yung characteristic kasi ng thalassemia, may example yung hypochromia, yung abnormal decrease ng hemoglobin content or erythrocytes. Mayroon siyang microcytosis or very small naman yung kanyang erythrocytes, opposite siya ng megaloblastic, and of course, the destruction ng RBC. Congenital dyserythropoietic anemia or CDA. Ito yung rare blood disorder na similar sa thalassemia. Ang CDA is one of many type ng anemia characterized by ineffective erythropoiesis na nagre-result ng decrease ng number ng red blood cells sa loob ng katawan ng isang pasyente o ng tao and less than normal quality ang hemoglobin in the RBC. Anemia of kidney failure. Kidney is the one responsible for releasing of erythropoietin. Myelopetetic anemia is a severe type ng anemia na makikita sa mga taong may sakit na affected yung bone marrow. So, it refers to the displacement ng hematopoietic bone marrow tissues by fibrosis, tumor, or granulomas. Myelo, which refers to bone marrow, petesis means shrinkage or atrophy. So it correlates to myeloproliferative disease, may mga leukemia, lymphoma, carcinoma, and myeloma. Myelodysplastic syndrome or MDS is one of the group of cancer in which immature blood cells in the bone marrow do not mature. Other mechanisms that may impair the RBC is the chronic inflammation and leukoerythroblastic anemia. It is caused by space-occupying lesions in the bone marrow. that prevent normal productions of the blood cells. So, since we're talking about impaired RBC, we're talking about the cofactors in the maturations of RBC. Increased destructions of red blood cells, or known as hemolytic anemia. This is more on intrinsic abnormalities, and some of the predisposing factors is hereditary or genetic disorder, autoimmune disorder, in infections like virus infection. So usually, nagkakaroon ng sequestrations or destructions of the RBC if the RBC's form is different or there is an abnormal RBC, like presence ng megaloblastic anemia in the pernicious and folate acid deficiency. So the RBC is so big, or if the RBC is so small, or the appearance of the RBC like in a sickle cell anemia, or there is an antibodies attached to the RBC, it could be considered as foreign bodies by the reticuloendothelial system. So they're going to sequester the red blood cells. So if there is a decreased red blood cells in the circulations, it may lead to anemia and leads to hypoxia. So when we talk about intrinsic abnormalities, it is more on the RBC itself. So pwede yung form niya, yung structure ng RBC, yung maturations, or na-release siya ng maaga sa circulation in the form of erythroblast. Any abnormalities or deformed RBC leads to sequestration. Example is hereditary spherocytosis. So there is a problem sa membrane ng RBC. There is an abnormalities leading for hemolysis. If there is a haemoglobinopathies or abnormalities in the hemoglobin, example is sickle cell anemia. It is severe hemolytic anemia resulting from the inheritance sickle cell hemoglobin, yung tinatawag natin na hemoglobin S. This is a genetic disorder causing the hemoglobin molecule to be defective that cause the red blood cells to be rough and become sickle shape. Extrinsic or extracorpuscular abnormalities. This is more on antibody mediated. Form autoimmune hemolytic anemia is caused by autoimmune attack against red blood cells, primarily by immunoglobulin G, and it is most common in the autonomic hemolytic disease. It can be idiopathic or unknown. That is without any known causes. It could be drug associated or secondary to another disease, such as example systemic lupus erythematosus, malignancy, presence of tumor, such as chronic lymphocytic leukemia. Rh disease, which or the parents of the newborn have blood incompatibility. This is one of the causes of hemolytic disease of the newborn. Blood transfusions reaction is one also of the cause. Mechanical trauma for red blood cells, the microangiopathic hemolytic disease, including the ITP, intravascular thrombocytopenic purpura. It is a rare condition in which thrombi occluded arterioles and capillaries of the microcirculations. Many organs is affected, including the heart, the kidney, the brain, and the platelet aggregation is the key features of this disorder. It includes in the trauma to red blood cells, the DIC or disseminated intravascular coagulation. It is the body response to injury or disease in which microthrombi obstruct blood supply or organ, and hemorrhage occurs throughout the body. So there is a presence of thrombus formations and presence of hemorrhage. Infections including malaria and parasitic causes. Blood loss in response of kidney and bone marrow to hypoxia produce more red blood cells. A premature RBC or lacking of the cofactors are released into the peripheral system. That is anemia of prematurity of RBC, since erythroblast is considered as foreign bodies by the reticuloendothelial system. It will be sequestered and removed into the circulatory system. Many types of cancer, including colorectal cancer, cancer of the urinary bladder. It may cause acute or chronic blood loss, especially at advanced stages. Gastrointestinal tract lesion, example is peptic ulcers, varicose lesion causing either acute bleeds or chronic blood loss. Example is angiodysplasia. It also may alter the absorptions of the cofactors, resulting for malnutritions on the cofactors. Gynecological disturbances like placenta previa, placenta accreta. It is where the placenta is attached deeply into the uterus, and there are portions of placenta that is not be able to detach from the uterus, causing for severe bleeding or chronic blood loss. Also, the preterm labor, abruptio placenta, and uterine rupture. So those are the gynecological disorder or disturbance that may lead for bleeding. Menstruations, mostly among young women and older women who have fibroids. Infection by intestinal nematodes, which includes the hookworms, the whipworm, which feeding on blood, causing for this pathologic disorder. Iatrogenic anemia, this is the blood loss from repeated blood draws and medical procedures. Thank you for watching. I hope you learned something. This channel provide information, lectures, and discussion of different pathologic disorder. Disclaimer: intervention and management may vary according to the actual status of the patient, manifestations of the disease, and prognosis of each patient. So learn more, be efficient, and be an angel in the sick room. Don't forget to like, comment, subscribe, and click the notification bell. I'm your nurse on duty. Until next time.